We've heard a lot about oral cancer in the news lately, and it's a good time to talk with an expert about your risk factor and what you can do to prevent it. I'm talking with Dr. Valerie Preston from 614 Dental Spa. So we've heard about Michael Douglas as well as Roger Ebert. Are those cases becoming more and more prominent, or is it just a coincidence?
I think there's a lot more awareness now. Oral cancer has risen in the past 10 or so years. A lot of that is that prior to then, it was mostly something that just those who smoked or drank excessively were prone to. Now the risk factors include just about anybody because of the human papillomavirus, HPV. People are aware of that causing cervical cancer, but they don't realize there's a tie-in with oral cancer as well.
Right. So it's a sexually transmitted disease.
It is a sexually transmitted disease, but it does carry over into the oral tissues.
How do you test, or is that something that you can notice when you're examining patients on a routine exam?
We have always done a visual exam on all of our patients. Now we also have advanced treatments where we check our patients on an annual basis with a special dye and special visual glasses to be able to see if there is something brewing beneath the top surface of the oral mucosa. And early detection is everything. If it's detected early, we can get them to where they need to be to have something done, very minor procedure. If it's more advanced, they can obviously get treatment with that as well. But the longer you let it go, it's very, very, very fatal.
So with people who maybe experience this, do they need to come to see the dentist more often, or is twice a year still a good benchmark?
Twice a year is pretty good for most because the cells don't change that rapidly that we could see something in between. But if somebody does test positive and we've detected that it's not cancer yet, but maybe a precancerous state, we will test them more frequently than once a year.
Fantastic. And if someone is in a state where this has progressed, you can certainly help them with getting to the next stage of care.
Absolutely. We refer them right away to a neurosurgeon so that a biopsy can be performed and they can get where they need to be.
But in the meantime, some things that we can all do to protect ourselves and try to prevent this type of cancer.
Basically, just about what everybody does to try to prevent any kind of cancer, just eating well and living well and, you know, just trying to take care of themselves.
And staying away from risky behaviors.
And staying away from risky behaviors and going to a provider who can detect these things and pick them out early on.
Is this something that patients should ask for, an oral cancer screening?
They sure should ask for it because everybody should be getting that or at least being offered that at their dentist. It is standard protocol, standard procedure, and we need to be doing this with our patients.
Dr. Preston, thank you so much.
You're welcome.
You can reach Dr. Preston at 614dentalspa.com or 919-518-0540.